Patient's face down, there's a headpiece that his face would fit into, like this, and then a head strap. My hands are going to mimic this headpiece, so we need him far enough off the table that his butt, so his shoulders are supported. However, we need his chin to be able to tuck all the way down without hitting the table. So I'm going to cup his head, and for this particular patient, we need to treat a disc in the cervical spine that's on the posterior lateral, so the back left side of his spine. So I need his head to come into lateral flexion, 45 degrees, or whatever degree we can set it at, and then flex forward 45 degrees to the right, go straight back 180 degrees backwards or extended 45 degrees to the left. And that motion would be repeat without a pause, a pumping action.
How many reps?
This one would be 20 reps. Each motion would be ideally set up to 20 reps. Some we might want to only do 3 reps, 4 reps, 5 reps, up to 20. So I'm going to pause that one. We need him to go back slowly and fall back into neutral. So if the ball can bring it back to neutral as the default, then the second exercise would start, which is only for this patient lateral bending or side bending to the right on a neutral plane or a 0-degree flexion. So again, a continuous motion from neutral or 0 to 85 degrees to the right. Continuous motion. Again, this patient is up to 20 reps. We'd like to set it anywhere from 1 to 20 repetitions, and that would be a continuous motion. I'm going to pause it. Want it to go back to neutral, not flexion. I'm just resting myself. And then the last one on this patient would be circumduction. So starting at neutral, we want to stay in the right half of the body, off to the right of center, and do full circumduction. And while I'm doing this, I'm applying slight pressure, so forward pressure on the right base of the skull, off to the side, a little bit behind the ear.
Left side.
Off to the left side. And then stabilizing with my right hand. Again, a continuous motion. Some people may only be able to tolerate this much. Some may be able to tolerate this much. Some might be more extended up here, but again, be able to set it with repetition up to 20. I'm going to pause that. So I'm going to give another example. And let's say this patient, we wanted to do a full range of motion. It's not a posterior lateral. This one we want to treat meninges or muscle stretching. So we bring the patient to neutral, and I want full range stretching of the trapezius, just the lateral sides, or meningeal stretching both sides. So point A would be here, point B would be here. We want to be able to set the duration of the stretch, so it can be a slow stretch, a pause hold at point A or point B for maybe 20 seconds, and then back to the other side, pause hold 20 seconds. Another option is a faster motion, just to get range of motion and pumping fluid back into the joint spaces, and that would look more like this. So a faster motion with a 0 pause at the end.
And then you want to do the up-down one, because
Okay.
you didn't do that yet.
Okay, and then the other one, just flexion extension,
Right.
straight in the straight plane. So another motion is a flexion extension, which would be forward as far as we can go, and backwards as far as we can go. Now Bernie has restricted motion going backwards or into extension, so I'll demonstrate that on a different patient actually, the full extension. So that motion would look like this. There doesn't need to be any pressure on the back of the head. That's that motion. Okay, you want to pause that and let me demonstrate.